The recent outbreak of the human metapneumovirus, Hmpv, in China has raised global concerns. This virus causes respiratory infections, with symptoms like fever, cough, and shortness of breath. Experts are worried that it could evolve into a pandemic similar to the coronavirus. The virus has spread to countries like Malaysia and Japan, in addition to China. However, detailed information about Hmpv is still limited, and research is ongoing to determine how dangerous it might be. Experts suggest that the virus may cause severe illness primarily in children, the elderly, and individuals with weak immune systems. Therefore, it is crucial to follow personal hygiene practices and avoid large gatherings. In response, Chinese authorities are taking high precautions and implementing various measures to control the spread. The World Health Organization is also closely monitoring the situation and providing necessary guidance. 1. Initial care. Rest. Getting adequate rest is essential for recovery. Stay hydrated. To prevent dehydration, drink plenty of fluids such as water, soups, or vitamin C-rich fruit juices. Healthy diet. Eating nutritious food boosts the immune system. 2. Symptom relief treatment. For fever and pain, medications like paracetamol or ibuprofen can be used to reduce fever and alleviate pain. However, it's important to take medicines as per the doctor's advice. For cough and cold, inhale steam from hot water, gargle with salt water to soothe the throat. 3. Severe case treatment. If the patient experiences difficulty in breathing or severe symptoms, it is important to contact a doctor immediately. Oxygen support. In cases of severe breathing difficulty, oxygen support may be provided in the hospital's ICU. Antibiotics. Although antibiotics are not effective against viruses, if there is a risk of bacterial infection, the doctor may prescribe antibiotics. Nebulization. If there are respiratory issues, a nebulizer may be used to help with breathing. For preventive measures, regularly wash hands, avoid crowded places, cover your mouth when sneezing or coughing, maintain distance from infected individuals. If the symptoms are severe or persistent, seek medical advice promptly. Timely treatment can help avoid complications. Human metapneumovirus, Hmpv, growth rate. Hmpv, human metapneumovirus, is generally more active during the winter or spring and causes respiratory infections. The virus has a high transmission rate, particularly in areas with high population density. The growth rate. Infection rate. Hmpv generally affects children, the elderly, and individuals with weakened immune systems. Global infection rate. According to research, this virus is detected in about 5% to 15% of children annually. Growth rate in children. The virus has the highest growth rate in children under 5 years old. Transmission methods. Hmpv primarily spreads through respiratory droplets. Person-to-person transmission, through sneezing, coughing, or touching an infected person. Transmission speed. In households, the infection rate spreads very quickly. Geographical spread. Recently, an outbreak of this virus has been observed in China. In urban areas, the virus spreads rapidly due to higher population density. Severe infection rate. The growth rate in severe infections is approximately 1% to 5%. Severe infections causing respiratory complications are more commonly seen in hospitalized patients. Growth control measures. Hand washing habits can reduce the infection rate by 20% to 30%. Avoiding crowded places and following hygiene practices can reduce the virus's growth rate. Expert advice. To control Hmpv, personal awareness and maintaining hygiene are crucial. By taking protective measures at the right time, it is possible to control the growth rate of the virus. An increase in the infection rate of human metapneumovirus, Hmpv, has been observed in China, although specific information regarding the mortality rate is not currently available. This virus generally causes severe respiratory infections in children, the elderly, and individuals with weakened immune systems. Experts advise not to panic, maintain hygiene, and consult a doctor if necessary. Although reports of Hmpv infection have been received from China and Japan, there is no significant outbreak of this virus in India as of now. The Ministry of Health and Family Welfare is closely monitoring the situation, and there is no need to panic at the moment, as per their statements.